The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. We're back, video, new season. Very excited for today's guest and today's topic. Dr. Mubashir, right? Am I saying that correctly?
Yes.
And go ahead and say your last name for us real quick.
Chaudhry.
Chaudhry. Okay. I was 100% sure that's what it was, but I didn't want to mess it up for you or our audience. Dr. Chaudhry, let's just jump right into it. Tell us, how'd you get involved in dentistry? How'd you become a dentist?
It's pretty simple. My dad is a retired dentist, and originally, actually, I wanted to go to medical school, but during the 80s at that time, part of it was lifestyle. The patients were seen by their primary care physicians, and all their friends that were physicians, they didn't have a lifestyle after work because they had to go to the hospital and do rounds. It's changed quite a bit. And for me personally, I liked seeing my dad at home after 5 o'clock and then also helping him in the clinic during high school and so forth, just doing random office things. So from there, I went to dental school, did general dentistry for 3 years and figured out that that's not exactly what I wanted to do and went back to do pediatric dentistry for 2 years.
So how long did you practice pediatric dentistry for? Are you still practicing today?
I still am practicing. I completed my residency in 99. So since 99, I've been doing pediatric dentistry.
Okay.
I have a couple of locations. I have some associates as well in the practice. And I sort of limit my practice to hospital dentistry.
Fantastic. So I know we're going to jump right into the next segment a little bit. So you clearly saw some problems that practices were having and some of your colleagues were facing, both pediatric, general dentistry specialties, what have you. And you came up with a solution to it. Let's talk about that problem a little bit. And it's bigger than ever. What's some of the big problems? What is the big problem that you see a lot of practices facing today?
Yeah, and number one by far is staffing or staff retention, finding qualified staff. And, this problem, I would say 15, 20 years ago, maybe it was non-existent. Staff were more loyal. You can say they wanted to stay on board with an office or a practice. And, turnover was rare at that point. And then things started to change. And then, COVID really, just kind of blew it out of the water in terms of staff leaving practices for various reasons. And then trying to find staff the traditional way was almost nearly impossible. This was the first time ever I experienced, for example, we put out an ad and get no response for like 8 weeks, 12 weeks at a time, just unbelievable. And now things have started to come around a little bit, but still trying to find good staff that will actually want to stay is extremely difficult for not just dental offices, but small businesses in general.
Yeah, it's really difficult. And I think one of the issues out there is income demands that people have right now in other industries competing, throwing more money at people who did work in the dental industry. But you've got a solution for this issue, right? You've got a solution to help take some of that pressure off dentists. Go ahead and tell us about that solution.
Yeah, the solution is pretty straightforward, actually. It's all about trying to offer staff that are educated, that are customer service oriented, and from a payroll perspective, cost about a half to or up to a half to a third of regular payroll costs. And these are remote staff out of the Philippines. That's for work that you do not need a live person in the office. In dental, for example, dental assistant, front office staff, a lot of this work can be done from home. COVID showed us that. But now you have remote staff that are just in a different country but work the same time zone and are highly qualified for these type of tasks.
Yeah. So let's talk about where's your company's primary source of, we'll call it offshore, nearshore, we can call it insourcing, whatever you want. Where are they from?
Philippines.
So let me ask you a question. I know the answer to this question,
Yeah.
but from guests and just obviously from my what I do. But tell me, why the Philippines? Why hire people from the Philippines?
So two things. One, my partner, co-founder, John Carrick, he has several other companies as well, and he's been working with remote staff from the Philippines for probably over 6 years. And he's the one that introduced me to this, and this is sort of how we formed this joint venture. But the key thing that you have to remember is anytime you have remote staff is one is what is their fluency in English and their command of the English language. So the Philippines, that's other than what they speak as their local dialects, they're all fluent in English. Most, if not all, the staff have at least a bachelor's degree, if not higher. So they're highly educated. And then they come from a customer service oriented industry in the Philippines. And so they're familiar with providing customer service. And they all want long-term employment. It's not as if they want to hop from job to job. So, you put all that together and you have a very competent staff that's, cost are highly reasonable, and you have staff retention.
Yeah. So let me ask this question, and we're going to talk about the upsides because there's a bunch of them, right? I'm assuming there's a bunch of them. Let's talk about the downsides a little bit. What are some of the downsides about having, a remote employee, someone who's not physically in the office?
Yeah. So one, Patrick, really the thing is, if, for example, even myself, when I first started, I was very hesitant to do something like that because I had not worked with remote staff ever before. But, like I said, COVID sort of gave us that hybrid position even in the office. The downside is I think you have to have a reasonable expectation of what you are expecting your staff to do. Okay, so they cost less. They're hard workers, but that doesn't mean you can, have them do 80 hours worth of work in a 40-hour time span. They're not machines. So I think expectations in terms of what do you want that staff to be able to do, what's their competency, and then have them work in that framework. That's number one. The other thing is, depending on the type of role that you're asking that staff to do, is the time difference. It is a 12-hour time difference. So that has to be taken into consideration as well. And then technology. Everything when you work remotely is technology based. So sort of have to be aware of having the right technology to onboard a remote staff as well. We can't be so archaic where the internet speeds aren't there. You don't have VoIP phone systems, things like that, to make the technology assist the staff in providing the best service.
Yep. My feelings have changed on this a little bit, but and I people are going to be all over the place, and it is almost a political thing too. But I used to always feel like, hey, you should hire right here in the United States. You should hire in your backyard. That's what you should do. That's the right thing to do. That's even the moral thing to do, right? Because I thought I was better than everybody else. I feel differently about that now. I actually feel now that, if you can give a great opportunity to a couple people who aren't here, it also gives you the ability to better the opportunity for the people that you have here. Would you agree with that? In other words, is this a way that you can actually, when somebody leaves an admin position, if you did replace them with someone, I'm sure that you could actually give the rest of your team a pay raise? Is that something that you see?
For sure. I mean, that's the positive side that we see from here is, two things. One, yes, you can use that money and actually help the staff that you have live. But the other is these staff, they do tasks that are redundant tasks that are, that take time away from what is the primary role in a small business when you have live staff is to provide the best customer service for your clients, or in our case, patients.
Sure.
So if my staff is busy doing redundant tasks, paperwork, or on the phone, and this the communication or the customer service goes down, that's a negative. We want that to be a positive. And the remote staff allow you to do that because they do redundant tasks at a very high level and a high efficiency. But exactly, I mean, we want the best staff to provide the best customer service for our patients or our clients. So
Sure.
we're not talking about replacing the whole staff. We're talking about one or two positions in a small business, or maybe a small percentage. And again, we have to think of it from a positive in terms of not only cost saving that can be reallocated, but then also providing support for the live staff that's there.
Yep. So what are some tasks that are common in most practices that are really easy to be shifted over to someone who's not local?
Yeah, Patrick. So this is sort of universal stuff, like incoming calls. We can handle making new patient appointments, scheduling, taking information like intake information, that's basic information, and pass it on. Appointment confirmations. Sure, we have text messages, emails, things like that. But depending on the locale that you're at, some people still want to be called and have appointments confirmed or changed, things like that.
Sure.
Insurance verifications, although a lot of the insurances can be done without having to do live calls, there's still some that you need to do that. Verifying insurance benefits, posting payments. These are all things that are done on a daily basis, but that just eat up time and cost. If you're paying someone, X amount of dollars and you can get it for, 0.3X, why not?
Right. So really any task in the practice that SOP, standard operating procedure, can be created for, right? That is something that's repetitive, that, does take time, is busy work, right? I like to call it just, there's a lot of things that I used to do that are just busy work that I literally could train even, my teenage son from time to time. I'd be like, hey, Ryan, I need you to do these things for me. Those are things that you should certainly be looking at outsourcing. Would you agree with that?
Absolutely. And even small things like, you were telling me you have a personal assistant, but, social media, whether it's posts or replies, things like that, you can have them do. It's not something that you need a live body, physical body with a high technical skill to do.
Sure. So let's say, you're like, hey, I want to give this a try.
Yeah.
Most people are going to be nervous about it.
Yeah.
I think almost anyone is going to be nervous about it in the beginning. And maybe forever, right? It might be a little nerve-wracking that you can't physically put your hands on someone that you're paying on a weekly or monthly basis. But if you want to get started, obviously reach out to Dr. Chaudhry and his team. That's one option. But what are some other ways? You would kind of want to do this on your own. If what are some ways that you can get going with this?
Yeah, I mean, the first thing is try to find out if you know anyone that is using it, so you have some live feedback, day-to-day type of feedback. If not, there are other ways to go about doing it. Some are, I think the most common is like Upwork, where you can just do the search on your own. You have a list of requirements, and then, you can try to go that route. Although you don't have that support built in terms of helping source those, the staff and those type of things. Or you can talk to other outsourcing companies, maybe not the Philippines, but other countries as well.
Sure.
There are many that are out there, but again, you have to find the right fit. What is it that you're looking for, and what is it that you want to do? For example, we don't do a lot of positions where there's tech jobs that are involved. That's not our forte. So that's not something if a client came and asked us to do. So if I'm a dental office or a small business and I want customer service, I may not want to go to a company that outsources a lot of tech jobs, So you have to be aware of what niche these companies are working for.
Sure. So SOPs are a big part of this.
Yeah.
And I think that's where there'd be a big failure, right? If they don't know what to do, they don't know what to do. They're not going to be able to guess and get it right. They're not magic by any means. And that's the big benefit of working with a company, correct? That specializes in this. You have training in SOPs, and you're actually kind of managing these people for them, right?
So in a sense, yes. So we provide, feedback to not only the client, but then we also get feedback from the staff. So that's sort of one thing that as a company that we want to set ourselves apart. We do a lot of, get feedback from the client and from the remote staff itself. So they want to make sure that things are moving forward in a positive way. The training is being done properly, but SOPs are huge. So if a client is not used to that, that's sort of something we can say, this is the task that you're wanting them to do, but this is something you need to do to create. And we can provide feedback on that as well. Not necessarily the
Awesome.
SOPs, because each office is different. But I have 2 offices, and each office works independently, and they all work a little bit different based on location, clientele, things like that. So
Sure.
we can provide positive feedback in that sense.
So, asking what it costs is always a bad question.
Yeah.
How much does something cost, right? It's not what it costs, it's what the ROI is on it. But I know our audience wants to know, so I have to ask it.
Yeah.
I'm going to encourage people always be focused on the return on investment. If someone costs you $1 million, but you get $10 million back, you do it all day long, right? So
Yeah.
there's obviously a return on investment that goes with this. But if someone's trying to compare with their in-house staff, from the low side, which would be, hey, go on your own, find somebody online who may or may not have a lot of experience, who may have no experience in dental and no training, that you're going to kind of, bring up yourself, all the way to working with a very experienced person who has training. I'm working with a company of yours. What's the full-time salary, the monthly salary price range there?
Yeah, I think across the board, we're just looking at, if we just do it hourly, we're probably around $10 an hour. If they're asking for a highly, experienced admin position, maybe even bilingual, then, $11, $12 range.
Yeah. And if you look at just, that type of income for someone in the Philippines, they're making way more than the national average of people in the Philippines, correct?
Yeah, for sure. And Patrick, the other thing is, as a company, what we don't do is we don't do like temp jobs or, hey, I want somebody to fill in for an hour, things like that. We were just talking about
Right.
SOPs and things like that. If you establish something like that, that takes time for the staff to learn and train. And so we want to actually use these staff and the talent that they have, but in a positive manner for them as well. So we want them to, ethical outsourcing, however you want to put it, in terms of either we offer 2 types of positions. One is either part-time or full-time, 20 hours, approximately 40 hours. But we want the staff to know, hey, you have a position, these are the hours you're going to be working, and this is the type of work that you're going to be doing. And then the client also has clear expectations there as well.
Makes sense to me. Dr. Chaudhry, thanks for being here. Real quick, we'll come back to you. I want to encourage the audience to check out the website, follow the links on our website, Dental Brief, on Facebook, and check out Dr. Chaudhry's site. If you have any questions about this, I'm sure his team will be available to you. Dr. Chaudhry, awesome. Thanks for coming on. Thanks for sharing. We appreciate you.
Thank you, Patrick. I appreciate the opportunity.